A recent study conducted by a collaborative group of scientists from the KEMRI-Wellcome Trust Research Programme in Kenya, the International Center of Insect Physiology and Ecology, ICIPE, Charité University of Medicine in Berlin, and Dabaso Tujengane Kenya sheds light on potential public health interventions to reduce Tungiasis cases, particularly in school-aged children. The researchers focused on 1,829 students from 5 schools in coastal Kenya, spanning various age groups. Structured interviews with 707 students provided valuable data on household infrastructure, behavior, and socio-economic status. The study revealed an alarming overall prevalence of 48% for Tungiasis, with boys between the ages of 10 and 14 years being the most vulnerable group. Socio-economic factors were found to be positively associated with the risk of the disease. Furthermore, returning students from their school holiday exhibited higher rates of infection. The researchers observed that mild to moderate Tungiasis could be reduced by a third, and severe cases by more than half, if homes had sealed floors. Additionally, sealing classroom floors could prevent roughly a seventh of cases, while daily feet washing with soap could mitigate another fifth of the infections. These findings underscore the importance of targeted public health policies to combat Tungiasis effectively. Sealing household and classroom floors can act as a crucial preventive measure, as the sand fleas primarily thrive in environments where they can penetrate the skin easily. Moreover, promoting regular feet washing with soap can significantly reduce the risk of infection. Implementing these interventions not only addresses the immediate health concerns associated with Tungiasis but also contributes to breaking the cycle of transmission, ultimately benefiting the overall well-being of affected communities. However, it is essential to recognize the broader implications of socio-economic factors on disease prevalence. Addressing the root causes of these disparities, such as poverty and inadequate living conditions, is paramount for sustained success in controlling and preventing Tungiasis. Collaborative efforts between public health authorities, local communities, and international organizations are crucial to developing comprehensive strategies that encompass both immediate interventions and long-term solutions to tackle this neglected tropical disease. Please remember to subscribe to our channel, click the like button, and activate the notification bell if you wish to see more content like this. Thanks for watching.